Mr. Mayor. We're very excited to give you an update presentation from our Director of Economic Empowerment and Family Resiliency, Ms. DeAnna Valentine. This is a presentation she's done for some community groups, most recently, I believe, or maybe there's been some I'm not aware of, but the Macedonian Call Group, that is a group of faith-based leaders. They were very pleased with the presentation, and we thought it would be good not only for the council, but more importantly for the larger community, to see the work that Ms. Valentine is doing and how we're approaching the work of trying to lift more people out of poverty. And some of the challenges and barriers that people who are in poverty find when they try to move from poverty to self-sufficiency. It is one of the council's strategic priorities, and it is something that we want to address as a larger community. It's not something government alone can address, and so we look to build relationships with community partners that share the same goal. And we thought that her presentation might be a good departure point for those who would like to partner with us.
So good afternoon, Mayor Gray and Vice Mayor Brown, and to council members. Thank you so much for this opportunity today. I certainly hope that you will find this as an informative presentation. I just wanted to share with you that I had an opportunity this past week to attend the Economic Mobility and Opportunity Conference in Baltimore, Maryland, and I am so excited about the additional contacts that I've been able to make and ideas that I've been able to get from other people that are also on the ground and doing this work. So I look forward to sharing that information with you all as well. So just a little bit of an overview. When we look at poverty in the city of Hampton, we need to look at what poverty looks like just across our region as well. And so what you see highlighted here in purple, and hopefully you all can see that okay, is that Hampton's current poverty level is 13%. And so that's hovering where we're just slightly above Suffolk, slightly lower than Newport News and Norfolk and Portsmouth. But what we know is that in the city of Hampton, our unemployment rate is also hovering around 4.2%. So as I start going through this presentation, sort of keep in mind where we are in regards to the rest of the region for poverty and some of the initiatives that we might potentially look at. The city of Hampton is a little bit unique. It's very unique, but when it comes to poverty, it's even more unique, specifically because there are not entire communities that are entrenched in poverty in the city. There are more pockets of poverty. This information was outlined in the poverty study that you all had completed in 2023-2024. You will see on this where the median household income in the state of Virginia is $90,974. However, in Hampton, our median household income is $67,758. So we're hovering somewhere about $23,000 less than the state median income. So that shows us that we have some opportunities to not only increase the median income for our households, but to also look at attracting employment and providing skills and training to our residents so that they would be able to work up to that median household income and even be able to surpass that. Again, you will see on here highlighted in purple where we are above, we're in the middle. And you may recall Mayor Gray mentioned during some of the budget information sessions that Hampton has been in the middle in regards to salary, and this also shows where we're in the middle in regards to median income. When we look at our poverty landscape, we see that there is a correlation between poverty and crime, but there's also a correlation between poverty and where we see that female-led households tend to be more highly impoverished than those households that are either headed by two heads of households, or by male household members. The ALICE population, as you all may know, is asset limited, income constrained, and employed. The individuals that are in this population are those people that are classified as the working poor. These are people that don't necessarily qualify for state benefits like SNAP or Medicaid, but also don't necessarily make enough money to get out of the situation where they currently are. And so any sort of a critical illness, vehicle might need repairs, housing repairs could very easily slide these individuals and these families backwards into poverty from where they've so hard tried to work out of. The working poor are harder to often identify because they don't qualify for those benefits. So when we start looking at, trying to identify people in communities where there are those pockets of poverty, the ALICE population don't qualify for benefits. They're not necessarily receiving any additional sort of resources. And so we have to make sure that we are being strategic in how we provide that outreach so that they're not overlooked in these communities. The people, the ALICE population, when we look at, and you can see on this slide as well, when we look at the ALICE population, and there's another slide as well that will speak to it, 40% of our population are living in that ALICE threshold or below. So when we look at combining both the ALICE threshold and our pocket of poverty, the people that are living in poverty, we're looking at more than 50% of our population between ALICE and poverty. There is a disproportionality, and you can see this on this slide, of the people that are either living in poverty or the people that are the ALICE household. So on this slide, you can see that, Black households make up the majority of people that are living in poverty. Our ALICE households for the whole city is 31%. When we look at the ALICE households in comparison to the people that are currently, and the families that are currently living in poverty, we see that people of color and minorities tend to make up a larger portion of both those people living in poverty and the ALICE population. The state average for the ALICE population is 29%. So we have more people and more families living in that ALICE threshold, the working poor, than the state currently has as a whole. So I went through that section a little bit quicker because I wanted to be able to spend more time on what poverty looks like, providing a little bit more texture to it, a little bit more depth to it, so that we start to realize that poverty is not just about finances. It's everything that contributes to poverty, so that we're having a full, 100% view of what we can do to be able to combat it. So when we look at situational contributors to poverty, there are disconnects. So over the last, 6 months at this point, one of the things that I have been able to identify is that there is a disconnect between the people that need the benefits and the people that are providing the benefits. Hampton is resource rich. However, the people that need the benefits don't necessarily know where to reach out. They don't necessarily know who to connect with. And then that gap gets even broader when there's a lack of communication or a lack of follow-up. That goes both ways, because there's also a disconnect between our resource providers and other resource providers. So we all know that COVID negatively impacted so much of the face-to-face work, that in-person work. And now with budget cuts, we also know that funding is going to negatively impact what people are able to do with the resources that they currently have. Speaking of budgetary constraints, so I've been speaking with different people in, our nonprofits, for-profits, et cetera, and there is a growing concern that they are stuck in this place between cutting programs and cutting staff. And if staff gets cut, then they don't have the staff to run the programs. And if the programs get cut, then the people that need the programs aren't able to move forward and be able to prosper. Systemic barriers. There is oftentimes a disconnect again when we start thinking about, well, it should be easy, or why is it that someone can't receive this, or why is this, this should be a simple process. And I can tell you that as a whole, not just in the city of Hampton, but as a whole, there are a number of systemic barriers that often hinder people from being able to exit poverty. And just as an example, oftentimes those systemic barriers could be anything from a long eviction, where we have landlords that routinely file where they file one filing after the other, after the other, after the other. The person pays, they're late again another month, so they file again. And so when someone is trying to transition to new housing, those are barriers that keep them from being able to move from where they are from one place to the other. The same goes when we're looking at our former offenders. Those barriers in regards to whether or not it's the criminal offense in trying to get a job or the criminal offense in being able to obtain housing, those are some of those systemic barriers that tend to keep people in those trenches of poverty. Competing priorities. This is very true whether or not it's for the population that we're serving or for the organizations that are trying to provide the service. So we know that people, there's strategic priorities and there's plans, but there's also the budget. And so there's also the resources as far as staff. So when you're thinking about goals and you're thinking about, okay, so what is the priority? Is the priority going to be housing? Is the priority education? Is the priority financial literacy? Those competing priorities oftentimes become, they become the end to an actual project because there's just not the staff, there's not the funding, or sometimes there's not the time, staff, and funding. Social complexity. Clearly, poverty has been around since the dawn of time. And so, like an onion, when we start thinking about what contributes to poverty, there are so many different factors, whether it's generational poverty, whether it's systemic poverty, whether it's just a particular issue that has caused someone to fall backwards and they've not yet been able to pull themselves out of that. The complexities of poverty also require us to be able to provide a detailed, a flexible approach to how are we going to assist people out of poverty. A cookie cutter approach has been shown not to work. Having just a one size fits all is not the best way to be able to make sure that we're walking with people through the process as they're able to transition, because oftentimes you all may have seen where there's substance abuse programs, and back in the day, substance abuse programs were for 30 days, and all of a sudden after 30 days, the thought was that you were supposed to be cured and ready to move forward. Poverty is just as complex. So a 30-day program, a 6-month program is not even enough to oftentimes be able to combat and move people forward and keep them in a sustainable place. Just those feelings of being overwhelmed. So, I'll paint a picture for you for just a little bit. When you have someone that is struggling to keep the lights on, and you have someone that is struggling with food insecurity and is trying to figure out how are they going to get to work because they've got, they're on E and they've been on E for the last 2 days, but yet they need to get to social services or they need to get downtown to be able to pay their real estate taxes. When they're having all of those competing priorities, and then the school calls and says that the child needs to be picked up, we have this stacking. When you see that tornado that's there, all of these things tend to negatively impact the person's ability. Mental health issues tend to impact that person's ability to be able to move forward. Future uncertainty. We're all in this same place right now where we're struggling to figure out what's going to happen next. What's going to be the next program that's going to be cut? What's going to be the next funding source that's going to be cut? And as we are proactive in trying to make sure that the people that need the help the most don't get forgotten, how do we manage those competing priorities, and how do we prioritize? Because some things are going to have to shift through this process. Compassion fatigue, silos, hopelessness. When we look at poverty and when we look at the ALICE population, this is what's meant by it's not just about the finances. When every door that you try to enter is closed to you, especially for that ALICE population that doesn't qualify for those benefits, then where do you turn to next? When the house that you've worked hard to be able to purchase or to furnish or to provide stability for your family, where do you turn to when every place that you're going to, the budget's cut, they don't have the program, they don't know when the program's going to come up again? Those things all contribute to the difficulty of people being able to exit poverty. When we look at vacancies and retention, when we look at our providers, when we know that there are people that need help, and when we know that there are people that are in this critical space of, in some essence, either home or homeless, but yet there's not the staff because of the vacancies, because of the turnover, because sometimes the people that are doing the work are also living in the same space and working in the same space. So the big picture, I mentioned before that poverty is so much more than money. Yes, it impacts finances, but if you look on this wheel, and hopefully you all can see this, poverty starts off with that income, those lower or that less income that people have. But how do you work your way out of that? Poverty, when you look at it, think of it as a web. It impacts hunger, your health, It impacts your neighborhood. We've already seen where there's a correlation between violence in neighborhoods. It impacts your mental health, substance abuse issues. I won't read through all of these, but when you start looking at even your social network, if the people that you are connected with are also in the same situation that you are in, sometimes it's hard to find that positive person. Sometimes it's hard to have that positive outlook if everyone is in that same boat struggling along. So when we look at being able to address poverty and being able to move people forward, just being cognitive and mindful that it's not just the finances. So some of the things that I've been looking at really look at the whole person, more of a comprehensive approach to being able to approach poverty, to really be able to attack poverty, to be able to provide not just services and programs, but to be able to walk with people on this journey, because it really is a journey. It's not just we're going to get you from point A, we're going to get you the job, but then what are we going to do? How are you going to expend your finances once you actually have this job? So one of the things that we really need to identify is what is needed in the community to be able to move people forward. Again, I mentioned the city of Hampton is rich in resources. Are those resources working? And maybe, we may have to have those really difficult conversations. Are your resources really working? Are our community providers providing the services that people need? Maybe these services were great 10 years ago. Maybe they were great even pre-COVID, but things have changed. The world has changed since then. So how do we take that deeper dive with the people in the communities that need the service? A centralized resource guide. So I don't know, I remember the big yellow phone book, right? The yellow pages, I remember that. And so sometimes you can go on Google and you can start looking for resources, and you get resources, and then you get more resources, and you start to forget what you were even looking for because there's so many resources. But then when you try to find them, when you try to contact them, those resources, if you're in crisis, do you have an hour to be able to figure out where the food bank is or where the clothing closet is or who might be able to assist with, light bill assistance? Do you have 2 hours to wait for a phone call? Oftentimes not. If you're using somebody's borrowed phone, if you're only using your cell phone that's based off of Wi-Fi, these are the competing priorities that people are trying to navigate and work around. So building a centralized resource guide, whether that's in the form of an app, whether that's in the form that's of a landing page or our home page or what have you, but something where people are able to see not just the resources that are city sponsored and city funded, but the resources that would truly benefit the community as a whole. And something that's up to date, because I can tell you, there are lots of resource guides, right? However, oftentimes people work in a niche. So if your niche is mental health, your resource guide might specifically look at mental health. If you're looking at, housing insecurity, then your resource guide might only be looking at food pantries and things of the like. So by the time you track down all those resource guides, that very precious time has already lapsed. So making things easier and more efficient would certainly be beneficial. Collaboration. One of the things that I'm going to talk about again in just a little bit is the Hampton Stone Soup Initiative. And so I'm not sure if you all know about Stone Soup or not, but when I get to that page, so that'll kind of be your ... so that everybody's still paying attention in a little bit, I will share more about that Hampton Stone Soup Initiative. A community partner roundtable. So, oftentimes we have groups of people that come together. And we have groups of people that come together because it's become customary and it's become routine. But we need to have a group that's action and goal oriented, a group that includes people with those lived experiences. And those lived experiences may be people that have been able to exit poverty, because then we can show people that it's possible. We can show people, hey, this is what they did. This might work for you. These are additional resources. But being inclusive of a population so that we can respect their walk, respect their journey, and the insight that they may bring to the table in regards to those gaps in services and those needs that really need to be filled. Targeted post-secondary education and specialized training. So 2 weeks ago, we actually held our first event, if you will, our inaugural event that was co-hosted with Virginia Peninsula Community College over at West Hampton Community Center. And what we did was we just had an informational session for people to come out and learn about the programs and the certifications that the community college offers through their workforce training program. one of the key things that we wanted to be able to make sure that people understood was that the majority of the people that we are currently working with would have qualified for these programs for free. And even if there were people that maybe didn't qualify for free, what they would have had to have paid would have been small nominal amounts, and we might have even been able to find other sources to be able to help fund some of those things. And so we know that people that have higher education tend to achieve higher wages. We also know that not everybody is built for the same thing at the same time. So being able to provide other options for people, being able to help people see that, that maybe you're not somebody that wants to be a CNA, or maybe you are somebody that thinks they want to be a CNA, but you really could be looking towards an LPN. Or maybe it's not an LPN, maybe it's an RN, or maybe it's actually that master's degree. When the city of Hampton held their job fair at the convention center, had lots of people that stopped by, and I'd ask, what is it that you would like to do? And I was met with a bewildered look, because oftentimes people aren't asked what is it that they would like to do. When you're living in poverty and you're having to accept only what's being given to you, that's a different question to be asked. What would you like to do? Well, you know what? I really like helping people. I think maybe I'll be a CNA. And so then my additional question is, well, what happens when your patient goes in the hospital? And what happens when your patient goes in a nursing home? And what happens when your patient dies? So how can we look at getting you a position and getting you that training that will provide you that sustainability and that upward economic mobility, as opposed to your person goes in the hospital and you have no income? Maybe you're not thinking about an LPN. Maybe you're thinking, you know what, let's stack a credential. Maybe it is CNA, but maybe it's phlebotomy as well. Maybe it's radiology tech as well, so that we're able to keep people moving in the right direction. Living wage employment is so important, and this is something that we can support simply by, encouraging our employers to be able to pay a living wage to families and to their staff especially. When you start paying a living wage, and living wage looks at MIT's study for living wage in the city of Hampton and state everywhere, it's really important that that living wage is the difference between living in poverty, moving forward into the ALICE population, but being able to actually move towards that middle class as we grow the middle class. Financial assistance for heads of households. This was one topic that was shared a lot. Do I need to rush? Certainly.
Yes, just a question before you get to part of your presentation.
Sure.
Write the questions down as you talk. Regarding the living wage.
Yes, sir.
Have we calculated what that is in the state of Virginia?
Yes, sir, I do. I can actually get that information to you both in Virginia and in the city of Hampton and surrounding.
And to follow up to that is, there are already employers who are debating over the minimum wage going to $15 per hour.
Yes, sir.
Okay, because they state that they can't keep employees, won't be able to offer various insurance, whatever they say that excuses are. So, and I'll ask some more questions later, but I'm concerned because when I look at the living wage for this locality, what does that look like, and what strain does that pose on the employee? It's kind of how we make it work together. We'll talk about it later, but just
Absolutely.
think about that.
Absolutely. Yes, sir. Absolutely. When I looked that information up, it is, the living wage is based on a certain set of criteria. And so it is looking at mortgage or rent, and it's looking at, food, those sorts of things. So it is based on a specific set of criteria, but I will get that information to you. Financial assistance for heads of household. This is something that, as I mentioned, was brought up multiple times during the Economic Mobility Conference, and even before when I was researching it. This is something that Richmond has done. Alexandria is actually wrapping up their economic mobility. It's actually called Guaranteed Income. They're wrapping up one of their programs right now, and Richmond, you all may have seen, has just started their 4th cohort for Guaranteed Income. And I'll just expound a little bit on that. What the Guaranteed Income pilots do, all of the ones that I have researched provide typically $500 a month over a certain period of time. Now, where this is different from some of the other financial programs is that people that are receiving state benefits, whether it's SNAP or Medicaid, are typically excluded from this. And it's typically geared towards people that are working, and it's that ALICE population that would be able to, not just continue to move forward, but be able to, build money for savings, pay down bills, get down payments together, those sorts of things. And I'd be happy to share some more of that information with you all as well. Reducing barriers to service provision, increasing availability and equity, affordable childcare. So I'm not sure how many of you all attended the social justice conference at Christopher Newport University in April, but one of the presenters mentioned that a year of childcare was the equivalent of 4 years at Christopher Newport University. I said that wrong. Let me correct that. That paying for childcare was the equivalent to 4 years at Christopher Newport University. And so when you start thinking about how expensive is it to raise a family and the need for additional childcare, whether it's in the city or whether it's regionally, we have people that we know are on waiting lists for childcare. The slots are full. Summer is getting ready to start. Kids are going to be out of school. So how can we make sure that we're having kids in a safe and learning environment, and that's also affordable to families? And then addressing identified areas of need. Oftentimes there's a great idea. Somebody says there's a great idea. We really need to do this. But have we asked the people that need it whether or not they truly need to have this? Or is it something that we're just duplicating? And so how can we not duplicate efforts? How can we not duplicate services, but actually identify and create things that will be able to benefit our community? So these are just some ideas. We have a robust establishments, restaurants. We have lots of things that are growing down in Phoebus, right? I just read not too long ago where Phoebus is a thriving community for restaurants and hospitality, and so that's great because that's where my current office is. But the other thing is that we know that Virginia Peninsula Food Bank also has a culinary arts program. We know that the Academies of Hampton has a culinary arts program. So this is an opportunity. Could we work with some of these programs to be able to provide some additional training as we look at growing that entrepreneurship lens for people to open additional restaurants? You all have seen where people are baking cakes and they are selling dinners out of their trucks and under their tents and whatnot. So how can we help those people to have, whether it's a brick and mortar business or being able to work in a shared space? Community marketplace. The picture that's on your screen is actually a picture of a community marketplace in Lynchburg, Virginia, that I visited a few times. And so, when we think about people that are crafty, I'll tell you, I've been down to the flea market and there are so many people that are selling their wares, so many people selling candles and all sorts of arts and crafts. How can we have that in a way that maybe is not only sustainable, but is something that's held more frequently, whether it's every weekend or during the week or what have you? Temporary housing and repurposing existing space. This has been very exciting, is what I will tell you to actually hear about. To hear about how churches and congregations have been able to use property that they already have, whether it's something that's been given to them through the estate, whether it's a house, whether it's land that they're currently sitting on and they're no longer using, being able to repurpose that space, whether it's for a child care center. There are even congregations, even here in the state of Virginia, that have repurposed land for housing, where they've been able to establish housing developments, whether it's for affordable senior communities or just affordable housing for workforce or what have you. Tapping into talent and community driven. So we all have our own connections with people that are that are knowledgeable. We have our connections with people that have connections with other people. And we are able to, when we start working together with all of these individuals, we are going to build a collaborative partnership so that people are not having to necessarily always go and pay or be put on a wait list to be able to obtain services or needs for anything. So how can you help? What can we do? This is one of the highlights, I think, of what some some of what I've been working on so far. And it is the Stone Soup Initiative. So if you're not familiar with Hampton, with the Stone Soup story, it's a folklore, I guess would be the word for it. And in essence, it just talks a story about a stranger that comes into a neighborhood, comes into a community, and he's knocking on doors and he's asking for help. And while he's asking for help, do you have something to eat? Everybody's telling him no. And so he knocks from one door to the next and everybody repeatedly tells him no. And so he takes his pot out his bag and he goes out here to Coliseum Central and he starts a fire and he starts boiling some water from, Buckrow Beach, and all of a sudden he throws a stone in there. And because people are people, everybody wants to know, well, what is he doing? And who is he? And does he have a permit? And where is his permission? And where are all of these things? And then before you know it, they start asking him. And so him or her, the person, and the person's like, well, I just thought I'd maybe make a little soup, but what would be good in this soup? A carrot. And then it's like somebody else is like, I have a carrot at home. Oh, you do? Well, we can throw it in the soup. Then the next person comes. Well, what do you have? I've got potatoes. And what do you have? When it's all said and done, there's enough soup to be able to feed the community. So when we start thinking about how are we going to move the poverty needle, how are we going to move the Alice population forward, it is a collaborative effort. Poverty is not something that can be tackled by just one group, by just one idea, one path, one suggestion, because everybody's story and everybody's path is different. So what's going to be needed to move this family forward? What's going to be needed to support this family when it gets difficult and it's easier to say, no thank you, I think I will just quit this job because I'm losing more in benefits than I'm going to be able to keep. What does that look like? What are people bringing to the table? What do you all have to bring to the table and your congregations to bring to the table, and just your knowledge base, whether it's skills, assets, time, encouragement, means so much. Just to be able to tell somebody, I see you, I'm proud of you, keep moving, because sometimes the road can get very, very long and it can get very dark. So when somebody knows that you're working on that self-improvement, that's certainly very helpful. Spreading the word about what we're trying to do. This is not new. We're taking a new approach to it by not only just involving the communities, but being intentional about the work that we're doing. When I'm meeting with people, I'm like, tell me your story. Full disclosure, I probably won't remember your name for a couple of times, but if you tell me your story, I will remember your story. And when I see that there's a resource that will benefit our community, then I'm sharing that resource.